All right. It looks like the trickle has slowed down a little bit. We might still get a few more people, but I will go ahead and kick us off. Welcome to the first breakout session period of Culture of Data 2026. Thanks everyone for joining us. I'm Julia Simhai. My pronouns are she, her, hers, and I'm going to be moderating this session. We also have Rita Rochelle, who is managing the Zoom. Her Zoom name is COD Breakout Room 2. So if you need help, you can chat um, that person, that name. Um, Everyone's muted now, but if you have a question during Q&A, we definitely want it to be interactive. So feel free to unmute yourself and speak up. We also have the chat function available for questions or if you need help with anything. I already mentioned adding your pronouns to your Zoom name if you're comfortable. Also welcome anyone to come onto video who wants to do that so we can have our presenters not feel like they're in a black hole, but understand if you don't want to. And I think those are all my logistics announcements. So we can move toward our presentation. We have one presentation. It's going to be about 25 minutes, and then we'll have a bunch of time for questions, and I'll close out with some final announcements at the end and get everyone out of here by 1:15. But we are going to start with Emma Bernick and Michelle Boscia to present Here to Help, the Value of Public Health's Seat at the Traffic Safety Table. So I'm really excited to hear about how they're connecting traffic safety data to social determinants of health and root causes of public health problems. So I will pass it to the two of you and go ahead and take it away.
Awesome. Thank you so much for that introduction, Julia. I see Michelle's just getting our screen up there and perfect. Thank you so much, Michelle. So, welcome all, and we really appreciate you attending our session. As Julia mentioned, our session here today is talking a little bit about how we've used data to enhance collaboration between public health and traffic safety. And we'll go ahead and introduce our presenters and talk a little bit about how this all came together. So my name is Emma Bernick, and I'm the Injury and Violence Prevention Planner at El Paso County Public Health. Part of my role is I facilitate the community-based impaired driving prevention grant alongside Fremont County, which is what we're here to talk about today. And then outside of my role, I also am the facilitator for the El Paso County Child Fatality Review Team. So I work a lot in the data space around injury and violence prevention, both with injuries and fatalities.
I'm Michelle Boscia. I'm the public health educator at the Fremont County Department of Public Health and Environment. I work on two different grants. I work on the Impaired Driving Awareness Grant and the Substance Misuse Block Grant that are both focused on youth in general. The Impaired Driving one focuses on adults as well as youth. And I work alongside Emma on a lot of it.
So, as we mentioned, what we're here to talk a little bit about today is how we've really been able to use data to further partnership between public health and public safety to improve the traffic safety realm and help a lot of traffic safety professionals understand why the public health perspective is so beneficial to a lot of traffic safety problems. We found a lot of success in being able to address traffic safety from this more holistic perspective that really centers that partnership between public health and public safety, but also includes all of the other elements that really it change the way that we address traffic safety, looking at things like roadway design. So working with our transportation engineers, our healthcare partners, both in the emergency response side and in the hospitals. We also work a lot with educators, whether that's traffic safety professionals doing education in schools or actually going directly into schools and offering some of this traffic safety education. And then also we see a lot of change within traffic safety happen at the advocacy and policy level and within the legal system. So really the goal of why we had developed this presentation was to get people to understand what the value of public health is in traffic safety and highlight how using public health frameworks and data can benefit the traffic safety community, and then really help our public safety partners like law enforcement understand the benefit of partnering with us as well. So you might be wondering, how do we actually do all of this work and how did we get connected? The answer to that is that El Paso County and Fremont County are the only two counties in the state that are funded through the community-based impaired driving prevention grant that both Michelle and I work on. The really cool part about this grant is all of the money for it comes from the Colorado Persistent Drunk Driving Cash Fund, or PDD. So you might have heard of this program be called PDD in the past. And the reason it's called that is because the fines that people pay when they're convicted of impaired driving are actually what fund our grant. So we're able to take the fines that people are charged when they're arrested for a DUI and put it directly back into prevention. We also do receive a little bit of funding from what's called the minor in possession funds. And those are, again, fines that are charged to any minor under the age of 21 that's caught in possession of a substance. And again, we're able to put that directly back into youth outreach and prevention. And the goal with this grant is to be able to address impaired driving with that public health subject matter expertise. So lots of you are connected to the public health world or work in it and understand that we really have a different approach to community outreach and engagement that can help move the needle on a lot of these prevention efforts. And I think that's why it's so beneficial for us to be involved in that impaired driving conversation. And one of the ways that we address community outreach and engagement from an innovative lens is that we do something called data gallery walks, which Michelle and I will actually demonstrate for you a little bit later in this presentation. And we also work on things like social norming campaigns. So really wanting to change the public perception through risk and protective factors about what is socially normal when it comes to things like impaired driving and substance use in general. And then lastly, we know that in public health, we're experts in collaboration and partnerships. And again, like I mentioned in the first slide, we know that the best way to address traffic safety is through that holistic lens that involves that variety of partners. So we're really happy that this grant allows us to do that.
So to do this, we use our public health established frameworks to guide our work. I'm just going to briefly talk about this since most of us should know them. The Strategic Prevention Framework, which we call SPF, helps us move step by step from assessment to evaluation. We also use the social ecological model, which reminds us that behavior is influenced at multiple levels, not just the individual, but relationships, communities, and even policies. And then we use the trans theoretical model to help us understand behavior change because people don't just flip a switch, they move through stages and sometimes they move back and forth through those stages. And then finally, we use the positive youth development, which focuses on building strengths, not just reducing those risks, but giving safe spaces for our youth and a voice in our community. These frameworks allow us to design prevention strategies that are evidence-based, sustainable, and tailored to real community needs.
So as Michelle mentioned, we use a lot of really specific public health frameworks to guide our work as we're kind of getting other community partners to understand the value of public health. And on top of the ones that Michelle just mentioned, we also really like to use the upstream prevention framework to get our partners in public health or public safety to understand why public health is and should be involved in the impaired driving world. So we kind of explain it to them like this. And I think this demonstration has been really helpful in getting them on board with us having a seat at the table, like we mentioned in the title of our presentation. So if we look at something like impaired driving as a stream, really when we do DUI enforcement and we pull impaired drivers off the road, while that is important and it helps keep people safe, that's a very reactive response or a downstream response. So we're waiting for people to fall in the river or we're waiting for them to get on the road impaired before we pull them off. So what we explain to them is we're not here to say that enforcement isn't important, but really our job is to help you address the problem by walking up to the stream and figuring out why people are falling in the first place or why they're driving impaired. So again, looking at that upstream lens that both addresses the social determinants of health piece as it relates to who's more at risk for something like impaired driving based on their built environment, their socioeconomic status, and things like that. And also looking at it as the root cause of impaired driving really being that misuse of substances or that excessive consumption. And I think that's been a really great way for public safety partners to understand why impaired driving is a public health issue. And normally we show a video kind of explaining that, but we know you're all experts in this, so we'll go ahead and move on from this one. So one of the benefits of the way that our grant is set up, like I mentioned, is that Fremont County and El Paso County were both recipients of it for the current 5-year grant cycle. And that's been a really cool opportunity to see how this grant is implemented in different communities with El Paso County being very urban, we're having a larger population, at least in the core part of our county. We do definitely have rural areas as well. And then Fremont County being a more rural area. We've seen so much value from this cross collaboration because here in our urban area and our larger population county, we have a lot more access to resources and partners. So there's quite a few things that were already developed for me when I came in that I didn't necessarily have to build up myself. And so I was able to kind of move our grant forward on a lot of the other strategies that we were looking at. But one challenge that comes with us being a larger county is that we do just have a larger population to cover, and we have a lot more variety in demographics and lived experiences than a smaller community might.
Like Emma said, this has been, and since we're neighboring counties, it's been a real treat to us because we can collaborate really easily. We meet monthly to see what we can do to help each other. Because Fremont County is such a small county and we don't have as many resources or the financial capability of getting those resources like El Paso, I have been able to take what El Paso had in place before Emma started on this grant and kind of gear it towards our own county. And we're going to talk about something that's been amazing that I actually took from El Paso and brought to Fremont. But some of the other things that we were able to do is they helped me build my DUI task force here in Fremont County. It's a regional DUI task force. I based it off theirs that they've had for 20 years. They helped me get it up and going, and it's just on fire because I had that support from a different county. They've also helped me build a youth action board, which we did not have here in our county, but they've helped me give me ideas of how to do that and how to get our youth involved. And without that cross collaboration, we wouldn't be able to do that. Not as fast as we have been, at least. And one of the other big things that came from this cross collaboration is our crash dashboards. There's some QR codes on the screen. One is for the Pikes Peak crash dashboard, and the other one is for the Fremont County crash dashboard. I found theirs and I thought it was amazing. So I took it and I built one for Fremont County, but I tweaked it. I tweaked it for what needed to be in Fremont County and from a public health perspective. So if you look at the two, Pikes Peak has only 4 things as at the top. They have fatal, severe injury, minor injury, and property damage only as their filters. I changed that and added possible injury because as a public health standpoint, possible injury doesn't mean it's a minor injury, which El Paso combined those 2 filters. I also included a pie chart, which El Paso didn't. So I was able to take theirs and gear it towards what I needed for my county due to that cross collaboration. And well, if we have time at the end, we'll show you a live demo of the dashboard. So impaired driving data walks. I don't know if you guys have ever done an impaired driving data walk, but this has been a huge thing for Fremont County and El Paso. And we also did a combined one for Fort Carson together. One of the most impactful strategies is a data walk. It is an interactive community engagement method where participants move through stations displaying local data that is put in terms that someone can understand that's not in the data world, which is important because the general public doesn't normally understand data, so they ignore it. But this isn't just about presenting that information, but it's also about dialogue and gathering different data from our community and using that to guide our work. What they see, what stands out, what concerns them, that all comes in play here. This approach is grounded in community-based participation methods, and it means that the community is helping us both with the problem and identifying some solutions that they think might help in our community.
So I'll show you guys a little bit about what this data walk actually looks like in practice. And like Michelle said, the beauty of this is it's an opportunity for us to both share data and then also collect it back from the community. And one of the ways I think that we've been really innovative in being able to increase the participation is finding locations in the community where we have a captive audience of citizens. So I actually did my first couple data walks in the DMV waiting room because I was thinking about where is a place I can get a lot of citizens where they are bored and have nothing else to do and are much more likely to actually engage with me. The DMV waiting room is a great place. They're also already engaging with a county service related to driving, so it doesn't feel quite as off topic, or it's a lot more related to what they're already doing. And again, they actually have the capacity and the time to stop and talk to me because they're usually just sitting there for at least 45 minutes waiting for their appointment. So these posters are an example of some of the things that I show in my data walk. The first one on the left being a screenshot of those crash dashboards that Michelle mentioned. I was very fortunate in that, us being a larger community, I had a community partner that developed that for me and it was already created. And so why I like to show this in our data walks is to really help people get kind of a picture of the breadth of the problem in our community. So recognizing that while obviously the majority of the crashes happen very centrally within like the urban Colorado Springs area, you can also see the dots extend way far out east into all of the farming areas. And I think one of the other parts about this poster that tends to be so impactful is that every single red dot on this map is a life that was lost to impaired driving in our community. And every single bright yellow dot is a crash that resulted in an injury serious enough that someone needed to be hospitalized. I also think this is important to show because these dots just represent crashes from impaired driving. So this map doesn't even include all of the crashes from speeding, distraction, or any of the other causes. And in reality, every single dot on that map was a preventable crash because impaired driving is always preventable. On the right, I also share some other types of data. And one of them that I like to highlight is some of that social norming data that we can kind of use Healthy Kids Colorado to demonstrate. So while oftentimes a lot of my data in impaired driving is focused around the negative, like wanting to highlight how many crashes or fatalities or injuries we're seeing, or sometimes I'll also share DUI arrests or a breakdown of crashes by the type of substance, I also always like to end it on kind of a positive note. So this is usually my poster that I have last in my data walk, which is highlighting that the next generation of drivers is really starting to make a difference and kind of a dent in reducing some of this impaired driving. So the majority of our youth are actually not drinking and driving, they're not driving high, and they're not riding with peers who are driving after using alcohol or marijuana. And I think that can be really, really impactful for people to see, to kind of have some hope in this, and then also really address that social norming piece of behavior change that we talk about in public health, which is helping people understand that I shouldn't do this because I perceive that everyone else is doing it, when in reality, the majority of my peers are already making the healthy and safe choice. And then if you perfect. So one of the other beautiful things about data walks is that we get to collect both qualitative and quantitative data. So this is an example of some of the qualitative data that I get out of data walks. These are just a few quotes from my very first data walk that I ever did, where I was kind of asking people, what did you think about this data? How did this impact you? And the cool part that I'm able to do with this is bring this back to my leadership and show, hey, our community is actually saying that we should be spending money on teaching prevention and safe driving. And then it also helps me identify things like people's protective factors. So the quote that says, my son needs to be more careful on the road, family is often one of the most common reasons that people share that they choose to drive safe and sober. So I know that that is a protective factor specific to my community that if I focus on and promote can make a really big difference. And then I also tend to get some insight on what strategies for impaired driving are most impactful. So like the person who shared personal experience is the only way that people learn. While obviously I don't want people to actually experience an impaired driving crash, that does help inform me that maybe sharing more of those real life stories and incorporating storytelling into the data I share can be really impactful in making an impact on people's perception of impaired driving. And then, like Michelle mentioned, we had a really exciting opportunity to take these data walks out to Fort Carson recently and do a combined data walk where we show both El Paso County and Fremont County data. And at this one, we actually did a voting activity where we had people, after walking through all the data, like the posters I just showed you, vote on the prevention strategies that they thought would be most effective. And these are all strategies that we are approved to work on through our grant, or that one of our community partners can work on. Like, for example, the increased legal consequences. We don't do that through our grant, but our law enforcement partners are considering options for starting to book DUIs in jails overnight or increasing the fines around DUIs. So we added that in there to be able to collect some data for them as well. And I think this is a good example of that quantitative piece where we can actually, again, use this data and go back to our leadership when we are working towards wanting to implement a designated driver incentive program, and maybe our leadership's asking, why did you pick this as our strategy? We can actually say, well, our community told us this is what would be most effective. And we know they made that decision or had that perspective after actually looking at the local data and being informed on how the issue is impacting our community.
So like Emma, I conducted 2 data walks. I did one during a full day here at our health department, and then one during the night, so people could come after work. So this is just one of the posters I shared at my data walk, and I had them do an activity called the traffic light. I had traffic lights made where you were supposed to mark like red if you don't have a plan of safe ride home, yellow if you are unsure of your plan, or green if you have a safe ride home. So the data actually surprised me. We had almost 86% of the people that participated say they had a safe ride home. But we had about 14% that said they don't, or they were unsure. And those are the people that we need to focus our efforts on, because they're the ones that don't know what's out there, or they don't know how to have that safe ride home. So just because we have 86% saying, yeah, I have a safe ride, we still have that 14% saying no. And that's a huge percentage, especially in a small community like Fremont County. And this data actually shocked a lot of people, especially comparing the 3 counties that are on that poster for Fremont, Delta, and Montrose, seeing Fremont County is the highest. And then I also did a story sharing poster at the very end of my data walk. I asked people if them or a relative had been affected by an impaired driver, can you share your story? And these are just 2 of the impactful ones that, like the first one, it was high school when it happened, and 35 years later, it still affects them in their lives. So that just shows you an impact of, it's not something that just happens today or affect them for a year or 2 years. It affects them for the rest of their lives. Or a friend of theirs was killed in their senior year from a drunk driving, and it impacted family, friends, and other driving. And these, like Emma said, that's 100% preventable, these car crashes. And we call them crashes, not accidents, because again, they're 100% preventable. They are not accidents. We use these stories here and we combined it with actual data numbers, and it seems to make a bigger impact in Fremont County when you have that personal story combined with numbers. And then when we combine data, community voice, and public health frameworks, we create prevention strategies that are not only effective, but meaningful. Public health brings the human contents to traffic safety. So it brings that human voice to the numbers. We help ensure that decisions are not just data-driven, but they're people-centered because the people matter, lives matter. To truly improve traffic safety, public health must have a seat at the table. Because prevention doesn't happen in silos, we need to work together. It happens through collaboration, shared understanding, and a commitment to addressing root causes and not just enforcement. So we'd like to thank you for your time, and we'll take questions, or I think if no one has any questions, we can go into a live demo of the dashboard.
I have one question I can start with, and definitely welcome others in the room to unmute or put them in the chat. I thought your idea about going to the DMV waiting room for a data gallery was so creative. Like I've seen data galleries happen a lot, but it's like in a conference room, everyone comes at the same time and you do it. And so I was just curious, sort of, Emma, if you had any learnings from that from folks who might want to organize a gallery that's kind of untraditional. And maybe if you have other ideas for creative locations that you've thought about. I think that was just I hadn't really heard of that before, so I'd love to hear more.
Absolutely. Thank you so much, Julia. That was like one of the pieces or ideas that I came up with towards the beginning of this grant that I was the most excited about because I really think tapping into the spaces of where we can meet the community where they're already at is where we have the most valuable engagement. So that's always the perspective that I've tried to have in this work is recognizing where are the spaces that people actually have the time and capacity to engage with me and that they're already at because data walks are great, but it's really hard to get people to a place even when you offer free food or incentives like we do. So meeting them in a place where they're already at and they have that time and capacity to engage was what I feel like made the DMV partnership so effective. And then I also think it was really nice for the DMV staff. I actually at my last one had one of the DMV staff workers say that she loves when I come because people aren't staring at her and asking her questions all day. They come to bother me. So it actually ends up being really beneficial for the staff there as well. But also a lot of them shared that they were like, we have people come in and talk about their crazy experiences with driving on the roads out here all the time, and we don't feel that our job gives us the opportunity to really address those pieces. So even just being able to open our space up to you kind of helps like our mental health in that sense and us to feel like we're having an impact on that piece. So I've been really surprised to see like how much the DMV staff has enjoyed having it. And it all started with one data walk. After the success of that, they started inviting me to all of their locations across the county. And then the one that we did out at Fort Carson was actually at their DMV slash the building that their Soldier Readiness Center was in. And their Soldier Readiness Center is the area that their soldiers have to go through before they deploy or when they come back from a deployment. So we had, again, a huge traffic of people just walking by, waiting in line, things like that. And I think really being able to catch them when they're waiting for something is the places that I found community engagement to be the most effective.
Yeah, that's great. I feel like there's a lot of opportunities, maybe even in public health buildings where people are coming for services and hanging around, or other places in the community where we can find folks, and it's not like, oh, we have to drag them to a whole meeting. We can get 5 minutes of input, which is great. Okay, there's a couple in the chat. So one question that came through from Lauren is, how do you engage industry and community partners in this work?
Being from Fremont County, we are very anti-public health here in our county. So the biggest thing that I have done is actually go to their building and talk to them and explain to them that we are here for you in our community. We're not here to tell you what to do or anything. We're here to help. We're here to help solve a problem we have in our community, and we need your input to help us solve that problem. And we need your partnership to do it as well. And that seems to get people more involved if you explain it like, we have a problem and we're here to help, and not just, we're here to tell you what to do. Because we had a big, huge issue with after COVID, honestly, and our relationships broke across the county. And so it's been an uphill battle the past few years to build those relationships. And that's what I've done. Just go in there and be like, we need your help. And this is what we're trying to do.
I also think our DUI task forces have been a huge part of increasing that collaboration piece. So, like Michelle mentioned, we here in El Paso County have had the Pikes Peak DUI task force, which kind of covers everybody near the Pikes Peak area. Honestly, we've invited Fremont up, we've had people from Pueblo, so we extend a little bit outside of Pikes Peak. But the beautiful part about that is that's been around for 20 years. And in the past, it was almost entirely law enforcement that attended this meeting. So when we received this grant, I just basically started showing up to those meetings and asking for that seat at the table. And I will say it probably took a year of me showing up to these meetings consistently before I was able to start building relationships with people. And our collaboration with law enforcement has just blossomed from me being able to show up to that and let them know, again, like Michelle said, I'm not here to tell you what to do. I'm here to be an extra resource and a partner, and to give you guys a perspective of letting you know that actually, when we work on prevention and we invest in those upstream pieces, we make your job easier in the long term. And I think explaining it to our law enforcement and traffic safety partners that way has been really helpful as well. That, like, when we prevent these behaviors, we ultimately make your jobs easier because there are less impaired drivers on the road or people driving dangerously and recklessly. And we're also stopping people from getting on the road and causing that potential risk and harm rather rather than waiting for them to get on the road and then hopefully catching them in time before that injury or fatality happens. So I think it's all kind of in the way you phrase it, and then just showing up consistently and kind of forcing people to talk to you has really made a big difference for us. And then, like Michelle said, she saw our DUI task force and how successful it was and used her grant to actually establish one for the whole upper Arkansas region. So it's her county and a couple other ones in that area, but it's really beautiful because it brings together a lot of law enforcement, but then also we have partners from the probation court, people on the legal side, Mothers Against Drunk Driving, and then those of us in public health as well. And I think that's where a lot of our collaboration has blossomed.
Great. Thank you both for that. And, kudos to you for all the work showing up and getting out into communities to make the partnerships. Our next question in the chat is for you, Emma. Considering El Paso County's distinct urban and rural areas, can you specify the top strategies for impaired driving and how did community preferences for these strategies differ during your data walks?
I love that question. Thank you so much. So I will say one of the biggest things that I see in the more rural areas or like the niche areas like Fort Carson or our military bases is there's a lot more push for the designated driver incentives in the improving public transportation piece because those tend to be the areas that don't have access to things like Uber and Lyft, where you have that designated driver alternative, or they don't have access to public transit. Or if they do, it doesn't run as long. There's not as many routes available, things like that. Whereas the ones I've done in the more urban area, people tend to focus a lot more on that increasing legal consequences or creating the substance-free spaces. So I think that's been really insightful is showing that like our rural communities or our rural areas tend to want more of that infrastructure built out. And then in the places where the infrastructure is already built out is where we tend to see people vote for more of that behavioral change piece.
Great. That's really interesting and makes a lot of sense, but you have to hear it from the community to be able to really confirm that's the breakdown. Okay, one more in the chat for Michelle. Can you talk more about the Youth Action Board? And does this action board provide input on the data dashboard that you've shown? And what do you do with the youth voices?
So the Youth Action Board is just being established. So right now we're working on building that rapport with our youth and getting them involved and seeing what they want to do with the Youth Action Board. We just had them create their logo and their mission statement. And so we're just trying to like build that up. They didn't have an input on the dashboard because that's something I've been working on for the past year. And it was done before our second meeting with the Youth Action Board. I think we've had 4 meetings so far. We have them once a month, but we're working on a passport program with them that they're really excited about that we adopted from El Paso as well. So that's what we're using their voice for right now is like what they want to do. Where do you want to take this as at the stage we're at right now?
Great. Thank you. Okay, we have time for more questions, or if Emma or Michelle, you wanted to do a few minutes to show us the dashboards, we can do that.
Yeah, I think we can jump over to the dashboard demonstration so Michelle has time to show you her beautiful work because she built this all by herself basically, and it took a very long time. But if you think of questions as we're going through this demonstration, please pop them in the chat and then we're happy to answer them after the demo.
Can you see the dashboard?
Yep.
So this is the dashboard. We started as Tableau and then we had to switch to what's called ArcGSI to build the dashboard. So it took a year after we got ArcGSI to build. Right now I'm working on making a manual so other counties that don't have those resources can actually build their own if they would like to. So with this dashboard, you can zoom in and out. It's for all crashes at this point. Like Emma, the red ones are fatal. We have serious injury, minor, and that possible injury, like I talked about earlier, I felt from a public health standpoint, we need to separate from the minor because that possible could become a minor. It could become a serious. It could become nothing. So to me, I felt like it needed to be separate. And then just property damage. We also, because this is paid for by the Impaired Driving Awareness Grant, we put in little indicators of where our liquor licenses are in Fremont County to see if there's a trend when it comes to impaired driving and where those liquor license establishments are. So you can click on them. It will show you the location, the name. You can click on one of the car crashes and it will show you where it happened and all the data that goes with it. You can come over here to the left and you can filter by our city and towns. You can do a date range. So right now this is for 2021 through 2024 data. Crash severity. So you can click on it and just do fatals. And it will show you all the little red dots of where our fatalities are. You can click more than one severity if you want to look at them. We also have driver impairment. So we have alcohol and drugs suspected. All of our data is suspected at this point for impairment because it is when the law enforcement enters the data into their crash system for CDOT. So it's always going to be suspected. And it's the same for Pikes Peak's data or dashboard as well. You can do alcohol or drug or all of them. Up here, it tells you, it'll change the severity. So if you click all the impairments in Fremont County, we had 9 fatalities from 2021 to 2024. That doesn't seem like a lot, but if you compare our population to others, it's a lot for our little community. And that's 9 lives that could have been saved. As how we always want to reiterate that, like that's 9 lives that we could have saved if someone didn't choose to drive impaired. You can also do contributing factors. So you can filter it by distracted driving, fatigue, which is also technically another form of impaired driving, impairment, aggressive driving. Yes, Emma, I did make sure it works on a mobile device as well. You can also filter it by road conditions. So was it dry? Was it icy? Was it muddy? Any of that type of stuff. If you click on them, you can see like if they hit a deer, a bear, which we have a lot of those apparently in Fremont County where our car crashes were involving wildlife. So there's a lot of interesting facts to it. Up at the top, you can go across and it will give you a line graph or a bar graph. So some people need those visuals. So we made sure to do that. And then on the right, we have total crashes by year, by month. So you can see when the most crashes happen each month. So December's our highest. By day, Friday's our highest. By hour, so 5 and 4 p.m. are the highest risks in Fremont County. We also have the top crash corridors. And then if you click the impairment, there's a little pie chart that shows you no impairment, alcohol and drugs or alcohol suspected. And to me, it's really friendly, user friendly. I wanted to make sure that people that aren't comfortable on computers could still use the dashboard. That was a high priority for me.
Okay, and that question came in for you about the idea of adding liquor licenses to the map and whether you found any connection between that and crash locations.
I don't think we dug too much into it, but we can actually look right now. We can go to driver impairment and we'll put this. So if you look at the little yellow or the little martini glasses, because I thought that was a cool indicator of liquor license. I don't know why. We have quite a few. We have some fatalities right here where there's 2 liquor stores within a block radius. And we have quite a few over here too. And these are all impairments that I have highlighted. Our main street and our Highway 50 corridor has a lot of liquor license. I'm surprised we don't have more crashes along there. But we do have quite a few out here where there's nothing. It's very rural out in this area. So
Nice.
I built it and then had to jump into something else. So I haven't had a whole lot of time to analyze everything yet.
Yeah, I think you could spend days like trying to look at different combinations. It's great. It has so much flexibility and different filters depending on the questions that you're asking. So,
And one thing I'll add too is I love the map being able to show the actual road because that area that Michelle pointed to where it's a little more rural, that is a very curvy mountain road. And so I think that I'm sure plays into
mhm.
the risk with impaired driving crashes. And so I think being able to see like the geographic context of where these crashes happen is one
Yep.
of the best parts about these crash dashboards.
Yeah.
We switched from Tableau to ArcGSI just because of the cost. Tableau wanted twice the amount the second year of the license, and ArcGSI cost us $700 for the year. So it was a cost benefit analysis part.
Yeah.
I just saw the question in the chat, so I figured
Yeah,
I'd
no, thank you for jumping in on that. Great. Well, we, I think, are just about up on our time. I have a couple closing announcements. Thank you both again for a great presentation. That was really interesting. And congrats on all the work you're doing in your communities and the ideas that you're bringing to reduce traffic deaths and impaired driving. So thanks everyone for coming to this session and engaging in the Q&A. The slides, I think Emma did put a link in the chat, and they should also be available on Sketch, where you can look at the full schedule for the conference. At the end of the conference, you'll get an email with an evaluation form. So please do fill that out when it comes. It helps us understand how to improve the conference year over year, and just is very useful for the planning committee. We have about a 15-minute break now. There's another breakout session round at 1:30 where you can choose between 3 different rooms. So take a look at the conference website or Sketch to see what you're interested in for the next session. And we just appreciate you being here and supporting the conference. So have a great rest of your day and conference day 2 tomorrow.
Thank you, everyone.
Thank you.